Yeah. So we're out to actually talk about hemolytic disease of newborn due to ABO blood group incompatibility. But for this one, it's not like all about the disease, so we're focusing on the treatment. And the treatment is basically the blood transfusion, like exchange blood transfusion aspect of it. Exchange blood transfusion usually abbreviated as what? EBT. Usually abbreviated as EBT. You get? So say that a 2-day-old born, this was a question, it was an exam question. So they put it in a clinical scenario. So they said that a 2-day-old born, alright, so the baby was born to a mother that had blood group O, and the spouse, that's the father of the baby, was blood group AB. So they presented to the clinic on account of what? Anemia. That's what? Low red blood cell levels, jaundice, unconjugated what? Sorry, this was not spelled well. I actually typed it. Unconjugated hyperbilirubinemia. Alright, and the baby is undergoing what? EBT. That's exchange blood transfusion. So you should answer this question. What's your likely diagnosis? This is also in here. What's your likely diagnosis? What are the lab findings? What are the agents of hemolysis? What is the mechanism of exchange blood transfusion on this patient? So you're trying to look at how you can use, like if you look at the whole question, right? You're just trying to look at how can you use exchange blood transfusion to solve an issue in a baby that has this hemolytic disease of newborn due to what? ABO incompatibility. So for this, the first question, your diagnosis of course is what? Hemolytic disease of newborn due to what? ABO blood group incompatibility. So I think there's no R in incompatibility, it's just T directly. So for me, I would like you to put, after this ABO, put what? Blood group incompatibility. Alright. Then number B is what? What are the lab findings? Of course, the lab findings were even explained in the picture. If you do blood grouping, the mother is blood group O with a high titer of hemoglobin G, anti-A or anti-B antibodies. So those anti-A or anti-B, they will attack what? Either the A part or the B part of blood group AB. So that means the baby will be having what? Blood group AB. They inherited blood group AB from the father. You get? So peripheral blood film, there's mild or moderate anemia because red blood cells are getting like broken down. There's microspherocytosis, there's polychromasia, there's reticulocytosis. As the red blood cells are being broken down, other ones are formed, but they are not reaching maturity. So the ones formed, they are basically trying to like compensate for what you are losing. So direct antigen test, that's a Combs test, is negative or weakly positive. Bilirubin levels are actually shooting up so high, and if you test the type of bilirubin that is present, it's the unconjugated one, right? Because red blood cells are broken down so much. When red blood cells are broken down, they form hem forms bilirubin, so bilirubin levels are actually getting high. Understand? So what are the agents of hemolysis? What is causing the breakdown of red blood cells? We spoke about it in lab findings. The mother has blood group O, so she has some hemoglobin G that are against the A parts or B parts of blood group AB. So mechanism of action of this exchange blood transfusion, like how exchange blood transfusion can be able to save the day, is usually removes antibodies coated neonatal red cells. Exchange transfusion, as you are removing, you are putting new on. As you are removing the baby's body, you are putting in new blood. So that new blood that is putted, well, it's usually like the mother's blood though. It replaces a infant blood with antigen-negative red blood cells. It could be it removes maternal antibodies. It corrects anemia. It's not the mother's blood group though, right? It could be the blood group AB that is giving back to the baby, but not the one that is contaminated. You get because the baby zone is already contaminated with antibodies from the mother side. It removes bilirubin, it suppresses what incompatible erythropoiesis, it restores albumin and needed coagulation factors.